What does it mean when the leader of the free world is posting on social media at 3 in the morning and then visibly falling asleep? During official meetings later that day, to a layperson, this might look like erratic behavior or poor discipline. To a physician specializing in sleep medicine, it looks like a textbook case, and the textbook is alarming. Normal human sleep follows a predictable architecture, 4 to 6 cycles per night, each including light sleep, deep slow-wave sleep, and REM, rapid eye movement, sleep. Deep sleep is when the body repairs tissue, consolidates memory, and clears metabolic waste from the brain through the glymphatic system. REM sleep is when the brain processes emotion and integrates learning. When this architecture is disrupted, the consequences are not merely fatigue, they are systemic. Cardiovascular risk increases, immune function degrades, cognitive performance, particularly executive function and impulse control, deteriorates precipitously. The paradox we observe, late-night wakefulness combined with daytime somnolence, is the classic presentation of severe obstructive sleep apnea, OSA. Obstructive sleep apnea occurs when the soft tissues of the upper airway, the tongue, the soft palate, the uvula, collapse during sleep, blocking airflow. The patient stops breathing. Oxygen saturation drops. The brain triggers a microarousal to reopen the airway. The patient never fully wakes, but they never achieve deep or REM sleep either. This cycle can repeat hundreds of times per night. Who is at highest risk? Elderly males, central obesity, short, thick neck, nasal or palatal anatomic variants. All of these apply here. And the sequelae are precisely what we are observing across every body system. Chronic nocturnal hypoxia, low oxygen repeated nightly, damages the cardiovascular system, elevating blood pressure and straining the heart. It damages the brain, particularly the frontal white matter and hippocampus. It disrupts hormonal regulation, leptin, ghrelin, insulin, worsening metabolic syndrome. It creates the daytime somnolence, sleep attacks, involuntary napping, and even micro-slumber during official meetings. And then the cycle compounds itself. Exhausted during the day, the patient uses stimulants, caffeine, prescription amphetamines, or other agents. To maintain wakefulness, those stimulants prevent nighttime sleep. The brain, already deprived, reaches for any environmental stimulus in the small hours. Hence the compulsive 3 a.m. posting. The use of prescription amphetamines, most notably amphetamine salts prescribed as Adderall, has been publicly alleged in reporting about this administration. From a medical perspective, this is entirely consistent with the clinical picture. A physician observing severe OSA-induced daytime somnolence might reasonably prescribe a stimulant to maintain daytime function. However, prescribing stimulants to a patient with OSA without aggressively treating the underlying apnea first is, to use a clinical metaphor, whipping a tired horse. The cardiac effects are dangerous: increased heart rate, elevated blood pressure, arrhythmia risk. In a patient already suspected of cardiovascular compromise and atrial fibrillation, this represents a significant escalation of cardiac risk. Furthermore, and this is critical for our psychiatric episode, amphetamine use in the context of sleep deprivation can exacerbate paranoia, hostility, impulsivity, and grandiosity. It chemically amplifies everything we'll discuss in episode 4. Watch for increasing visible fatigue or glassy-eyed affect at public appearances, especially in the afternoon. Worsening weight despite claimed dietary changes. OSA and metabolic syndrome create a hormonal environment that promotes weight retention, regardless of caloric restriction. Any public emergency or sudden hospitalization occurring in the overnight or early morning hours, the period of highest cardiovascular vulnerability in OSA patients. Sleep is not a luxury. It is the foundation upon which all other organ systems depend. When it fails, everything fails, together and progressively. Next, we enter perhaps the most sensitive territory, the mind itself. Episode 4 examines the psychiatric and cognitive findings, and what a psychiatrist and neuropsychologist see in the behavioral patterns that have become impossible to ignore. Learn more about this and other stories on youandbedsidemanners.com.